All right, today we're jumping into a really common and honestly pretty painful hand problem. We're going to break down a clinical study that puts two very different surgical fixes head to head to see which one really comes out on top.
You ever had that weird feeling where one of your fingers gets stuck when you try to bend it, and then it just clicks or snaps straight? If that sounds familiar, you might know exactly what trigger finger is.
So what is going on in there that causes that super annoying click? Let's get right into it.
Okay, so think of it like this. You've got a rope that's your flexor tendon, and it's running through a bunch of little pulleys in your hand. Now with trigger finger, that very first pulley, called the A1 pulley, it gets all inflamed and swollen up. So the opening gets way too tight for the tendon to just slide through like it's supposed to. And what happens? It gets stuck. And that's where you get that classic locking and snapping sensation.
Now, for a lot of people, things like anti-inflammatory drugs or steroid shots can really help. But when it's a severe case and none of that stuff works, surgery is pretty much the next step. The goal is to release that tight pulley. And this is where our showdown really kicks off.
So, when you're looking at surgery, there are basically two main ways to go. Let's meet our two contenders.
In one corner, you've got the classic open-release surgery. This is the old-school, established way of doing things. It means making a 15 to 20 millimeter cut in your palm. But in the other corner, we have the modern challenger, ultrasound-guided percutaneous release. This one's minimally invasive. And the incision? Just 2 millimeters? I mean, that is a massive difference right there.
And check this out. This is the actual tool they use for that modern procedure. It's this tiny specialized knife. The surgeon uses an ultrasound to see exactly where they're going, and they slipped this thing into that tiny 2 millimeter hole to release the pulley. Pretty incredible, right?
Okay, so which one is actually better? Well, a clinical study from 2023 decided to find out, putting them head to head. Let's dive into the data.
All right, here's a look at the raw numbers from the study. Now you can see that a month later, the ultrasound group had a little less pain. But honestly, the real story is in those last two lines. Look at that. The ultrasound folks only needed painkillers for about 7 days. The open surgery group, almost 14 days. And getting back to your life, about 15 days for the ultrasound group versus 21 for the classic. I mean, those differences are pretty huge.
So numbers on a chart are one thing. But what does that actually feel like for a patient who's going through this? Let's break this down into what it really means for recovery.
First up, time. We're talking about getting back to your normal life almost a full week sooner with the modern technique. 6 days sooner, on average. That is a big deal.
And this is huge. The time people needed pain meds was cut in half. We're talking about a 50% reduction. Just a week on painkillers for the modern procedure, compared to 2 full weeks for the classic one. That's a massive difference in comfort.
And really, this chart kind of says it all, doesn't it? When you look at patient satisfaction, it's not even close. Over 94% of the ultrasound patients were happy with the result. For the classic open surgery, only about 76%. And the study found the biggest complaints for the classic method were, you guessed it, the scars and the pain.
So when you put it all together, the conclusion from this study is crystal clear. The researchers pretty much spelled it out. They said that the ultrasound-guided surgery led to a faster recovery and less intense pain, plain and simple.
So let's just boil this down. Here's the most important part. Both surgeries worked. They both had a 100% success rate at actually fixing the problem. But, and this is a big but, the ultrasound method was just better for the patient. It meant less pain, getting back to your life a full week sooner, and, well, people were just a lot happier with it. And it all comes down to that tiny incision, which means less damage and a way smoother recovery.
Which really leaves us with one big question, right? When you've got a newer technique that causes less pain, gets you back on your feet faster, and works just as well, is it just a matter of time before this becomes the new go-to for fixing trigger finger?